I'm Ben Gonzalez, and this is TDI. Today we're talking about surprise medical bills. These are when you go to the hospital and you get an unexpected charge afterwards and you're trying to figure it out. But the good news is there's some new protections for patients in the law. And joining us today is Eric Casas to tell us a little bit more about what you should know about those. Hey, Eric.
Hey, how you doing?
Doing well. So let's get right into the basics. What are we talking about when we say surprise medical bills?
So surprise medical bills, that's kind of what it sounds like. You go to the hospital and you don't know if your provider's in network, out of network, and you get a bill afterwards. And usually the reason why that happens is because if the provider's not in network, they're obviously not contracted with the health plan. And the health plan usually doesn't pay the whole bill, and the provider comes in and bills the patient for that remainder. The
remainder of that, which is why it's also known as balance billing.
Exactly. Yes, sir.
So Eric, here in Texas, there was legislation that kind of addressed surprise bills, correct?
Yes. It's called the Independent Dispute Resolution Process, and this was started like a couple of years ago. Mm-hmm. Broadly speaking, if you have a plan that's regulated by the states, which is, easy way to figure it out is if it says TDI or DOI on your health insurance card, right. That's usually a pretty good indicator. You would have protections in case of an emergency or in case if you have a scheduled procedure and at the last minute they switch out the provider. I mean, those are the bigger instances where you would be protected from balance billing.
And the new thing now is that there's Congress has taken action,
yeah,
and more people are being protected on surprise medical bills.
Right.
Are the protections about the same as what we had and now the larger?
They're very similar in the aspect that they protect consumers in emergency situations and when they don't have choice for providers, but also they prevent balance billing from air ambulances.
Okay.
Not ground ambulances, but the air ambulances have usually a bigger bill that they send out. Definitely.
So what if you do get a surprise bill now? What should you do?
Well, you can contact your health plan, because if your plan is regulated by the state, it's usually a contractual obligation or co-insurance, co-pay.
Mm-hmm. It may be a surprise to you, but it may not be the same as a balance bill.
Exactly. Yes.
Okay. So is there anything we should do before we go to the hospital for a procedure to try to avoid any surprises?
Well, try to do your due diligence as much as you can, but if at the last minute they switch out your provider, you should be good. Or if you go into an emergency, that's what the law's for.
That's what the law covers you for.
Yes, sir.
Okay, if people still have questions about billing or health insurance in general, where should they go for answers?
They can visit our website, tdi.texas.gov. We have a fairly easy questionnaire you can follow, and you can determine what the best course of action would be. Also, you can give a call to the Federal No Surprises Help Desk, which is 800-985-3059.
All right, perfect. Well, thanks for being here today, Eric.
Definitely. Thank you for having me.
You bet. And if you have more questions about health insurance, visit our website. It's tdi.texas.gov, or you can call our helpline at 800-252-3439. So for Eric Casas, I'm Ben Gonzalez. This is TDI.